guys, welcome to Twincess's YouTube channel, the Stellar Nurses.
So in this video, we'll be telling you about knowing and mastering your menstrual cycle. So, menstrual cycle is the time from the day a woman sees her period till the day before she sees her next period. Simply put, for instance, if she sees her period on the first day of June and then her next period is on the first day of July, her menstrual cycle started from the first day of June and ends on the 30th day of June, and that makes one cycle.
Menstrual cycle are those series of events that occur in the female reproductive system. When we talk of the female reproductive system, we talk about the womb, the vagina, the ovary.
It also includes the breast. Breast is also part of the female reproductive system.
These events that happen in the female reproductive system is so as to prepare it for pregnancy.
Now, in this menstrual cycle, we'll be making reference to a 28-day cycle. Although people have their various lengths, people can have theirs for 29 days, 30 days, 31 days. It depends. We actually vary for a period of 21 days, can be as short as 21 days, and it can be as long as 35 days. But in this video, we'll be making reference to a 28 days menstrual cycle.
The menstrual cycle is divided into 3 phases. We have the menstrual phase, we have the proliferative phase, and we have the secretory phase. Remember, we are talking about we are taking 28 day cycle for an instance.
So, talking about the menstrual phase, this is the first phase. Now, in this menstrual phase of a 28-day cycle, it is meant to last for a period of 4 days. Remember, we are making reference to a 28-day cycle. For a lady with a longer cycle or a shorter cycle, it might last longer or shorter. But for the 28-day cycle, it is for a period of just 4 days.
And the content of this menstruation, which people know as menses or period, the content are those blood from the womb lining or unfertilized egg that was unfertilized during ovulation, as well as blood from the uterus.
This is the period that we know to be menstruation, where ladies tend to apply pads on their panties so that they don't get stained. So during this period, if pregnancy does occur prior to, the woman will not menstruate,
because menstruation is an evidence that the woman is not pregnant. A pregnant woman does not see her menses.
So for this menstrual period for this menstrual phase to occur, that means pregnancy did not occur. And so with a blood flow and a period of 4 days, that ends the period of this menstrual phase.
The next phase of the menstrual cycle is the proliferative phase. In a simpler term, to proliferate means multiplication, to multiply. The lining of the womb has already been shed during menstruation, so another development has to occur in order to prepare the womb for pregnancy, and that's what happens in this proliferative phase, development of the uterus in order to prepare for pregnancy.
So, saying that the proliferative phase ends with ovulation. Ovulation is simply the release of matured egg from the ovary, which is actually being stimulated by hormones.
During the release of this egg during ovulation, some women tend to feel abdominal pain. It varies in women. Some people may feel pain, while some may not, depending on the individual. The feeling of this pain in the lower abdomen is an evidence that ovulation is taking place.
Since we are still making reference to a 28-day cycle, this phase lasts for a period of 10 days for a woman of 28 days cycle.
However, it varies. A woman who has a menstrual cycle of less or more than 28 days, her proliferative phase tends to last longer or less longer,
depending on her cycle length. And so the third phase of the menstrual cycle is the secretory phase.
Secrete means to produce.
So at this point, the woman needs to take note of the texture of her vaginal discharge. Normally, the vaginal discharge is usually dry and thick, but after ovulation, it tends to be thin, elastic, and wet. That is what goes on during this secretory phase of the menstrual cycle.
Also, having said that ovulation has occurred, I told you before that ovulation means egg release. This egg release, actually, it can be fertilized by sperm, and the duration during which it can be fertilized is less than 24 hours. However, sperm has the ability to survive in the female reproductive system for a length of 3 to 5 days. That is to say that if sexual intercourse has already occurred before ovulation, there is every tendency that pregnancy can occur. However, since the egg be fertilizable within 24 hours, that means that after ovulation, within 24 hours, if sexual intercourse hasn't taken place, this egg degenerates and is no longer in its fertilizable form. If the ovum is fertilized during this period, pregnancy occurs. If it isn't fertilized, pregnancy doesn't occur, and then menstruation occurs. However, since we are talking about a 28-day cycle, the duration for this particular phase, which is the secretory phase, lasts at least 14 days. Yes, so lasts for 14 days. So making reference to a 28-day cycle, we talked about 3 phases of the menstrual cycle. The first, which is the menstrual phase, that lasts for a period of 4 days. The second, which is the proliferative phase, that lasts for a period of 10 days. And the final stage, which is the secretory phase, that lasts for a period of 14 days. And that makes up a 28 days cycle. However, taking an instance of a 30 days cycle, the menstrual phase is likely to last for 5 days. The second phase, which is the proliferative phase, is likely to last for 11 days, while the last phase, which is the secretory phase, is likely to last for 14 days, making a total of 30-day cycle. So that is how it has been calculated. That is why it's necessary that you know your menstrual cycle, you know when you're ovulating, you know when is your safe period, and when is the danger period to avoid sexual intercourse.
And since the average cycle length varies from one lady to the other, in order for you to master your own cycle length, so that you know when you're expecting your period or the period during which you should be ovulating, you should calculate your cycle length of days for a period of 3 months consecutively, so that it will help you to know when exactly, and not for you to just guess, okay, maybe today I'm expecting my period, or tomorrow. No. When you master your menstrual cycle for a period of 3 months consecutively, it will help you to be sure of when you're ovulating or when you are menstruating. Now, take for instance, you want to master it for a period of June. For the period of June, let's say it take you 28 days for you to see your period. You take record of it. You keep. For the next month, it took you 30 days. You see how it's varying. So, in order for you to be sure, just how you have to do this. For the month of June, it took you 28 days. For the month of July, it took you 30 days. For the month of August, it took you another 30 days. Now, how would you know that how would you know that this is actually your cycle length and what it should be?
you sum up the number of days for the 3 months, which include 28 plus 30 plus 30. It's going to give you a total of 88 days. Now divide this 88 by 3. You're going to get a total of 29 days. That means that you as a lady has a cycle length of 29 days.
Yes. And so that's just how it varies from one lady to another. So yours, you may calculate yours and it will be 30 days, and then you just have it at the back of your mind that you have a cycle length of 30 days. So if, as you have calculated, this lady's average cycle length is 29 days, she should be aware that her day of ovulation is on the 15th day, that is of a 29-day cycle. Her day of ovulation is on the 15th day. If it's a lady of 28-day cycle, her ovulation day should be on day 14. I will say that again. If as a lady she has an average cycle length of 29 days, then she should be aware that her day of ovulation is on the 15th day, that is of a 29-day cycle. But of a lady of 28-day cycle, aware that her day of ovulation is on the 14th day, doesn't want to get pregnant, she can abstain from sex during this period, that is 3 to 5 days around this 14th day of her ovulation. But on the other hand, if she actually wants to conceive, she can actually have sex with her partner on this day of ovulation.
However, there are some factors that alter the menstrual cycle. Some factors that bring about the irregularities of menstrual cycle. Sometimes this month you may not see your menses, in the following month you may see your menses. These factors include, number one is pregnancy. Like I said before, a pregnant woman does not see her menses. Another one is contraceptive pills. Contraceptive pills alters the menstrual cycle. And also we have uterine fibroids, and also in some cases it may be infection. These are what alters the menstrual cycle. Also, however, there are other factors that alters this menstrual cycle. Thank you for watching our video. Please don't forget to click on the subscribe button and the like button. Also, we can accommodate any questions in the comment section. Thank you. Bye.
Bye.
Bye.